Hi, I'm Tracy Presley with the Brain Coaching and Psychotherapy Place here in El Paso, Texas. Today I'm going to be teaching you about my conscious breathing. There's three parts to it. The first part is the physiological sigh. I'm going to go ahead and explain it, and I'm right here. I'm going to leave you the place to forward it to the part of the video where it's just the actual practice, so the technique and the practice. So, our body has two systems for our nervous system, the parasympathetic and the sympathetic nervous system, which are part of the autonomic nervous system of our body. Sympathetic nervous system and parasympathetic nervous system. The sympathetic nervous system is the part of our system that wants to or that reacts to anything that perceives trauma by our brain or our body. So if our mind perceives that there's an emergency or danger, then it sends the chemicals to our brain, which in turn sends, lots of structures are involved, but sends chemical reaction through our vagus nerve to all of the organs in our body, like heart, where we'll get the fast heart rate because the cortisol and the adrenaline is rushing through our body. Our lungs expanding and contracting. Our stomach, it goes to our stomach because it's going to tell your stomach, I don't want to be eating food. I don't want to be processing food. I don't want to expend energy on food digestion when I'm in survival mode. So it usually makes you nauseated or even throw up. Goes to our intestines as well. And our intestines says, and our bladder, they say, well, I'm not interested in having any feces or any urine inside of my body right now. I need to expel that because I need to use all of my energy resources only for survival. So that's how it comes. Sometimes people get so scared they peed their pants, right? That's what happens to the little chihuahuas when they get really nervous and then they start peeing. Well, it's their sympathetic nervous system going to their organs through their nervous system and telling their body to expend any kind of energy that's already existing so that you can only use it now on survival. So we get false narratives in our mind. Our mind tells us stories that maybe are not true. Sometimes they're true, sometimes they're not true. But when they're not true and we get this surge of energy and this need to survive, we go into fight, flight, freeze, faint, or fawn. If you don't know what fawning is, you can look it up. I'll leave the word right here so that you can Google it and see what it is. Our body reacts in survival mode, and it needs the body to have all of this energy so that we can fight for our life. But when there's nothing to fight for, it usually turns into anxiety. It usually turns into some chronic inflammation, anxiety in our body. So what we want to do is we want to learn how to, through our body, put ourselves into the parasympathetic nervous system activation, so that they call that also the rest and digest, so that our body feels calm. This is what we call bottom up therapy as opposed to top down therapy. Top down therapy would be like cognitive behavioral therapy, where we change your thoughts, we change our actions. But as you know, when we're in survival or when we're in anxiety mode and we have all of these racing thoughts and we have all of these ruminations about what's going on about the past, present, or future, it never worked when somebody said, calm down, just stop thinking about it. I don't think that's ever worked for anybody. So if you're an anxious person like me and we've had these thoughts where you just go around and around and then your body starts to go through the reactions of anxiety and panic attacks and the heart racing and the nausea and everything that your particular body might be going through, it's time to use a bottom up approach, which is what the physiological sigh is, right? So the physiological sigh is initiating another natural calming down system. It's a double sip. Do you remember, do you recall ever having to, or when you cried so hard, like you went, you're crying so hard and you're doing this kind of a double breathing, right? Dogs do it also when they're going to sleep. We do it also when we're going to sleep. They'll go, we do that naturally because we're trying to calm our bodies down, and that's our instinctive way that our body says, everything's fine. It's time for rest. Let me calm you down. And it does this double sip of well, it's a double breath, but it's really getting more oxygen into our body. So when we get more oxygen into our body, the double sip is actually breaking up the alveoli in our lungs. The alveoli are little teeny tiny sacs that are available to us, but sometimes they go into atrophy, meaning they don't get used, so they get weak. And the double sip will break open those alveoli and give us access to more oxygen. So that when we're doing this breathing technique, this physiological sigh breathing technique, we're not only opening up these sacs for more available oxygen, but what we're doing for our body is we're oxygenating the blood, and it's going to our brain. So it's leaving space in our brain and our prefrontal cortex to not shut down. It leaves it space, oxygen available, so that we're able to use our executive functioning and not go down those rabbit holes of ruminations about the past, present, or future, right? So when we do the oxygen in our body via the physiological sigh, what we're also doing is we're putting so much oxygen in our body, we're offloading the CO2 in our body. And infections, viruses, bacteria, they don't like to exist in oxygen. So we're also reducing the inflammation in our body. What more could you ask for? The physiological sigh, huh? Anyways, I'm going to go ahead and start the technique for it. If you have any questions, please don't hesitate to ask in the comments below. And so now we're going to do the technique. I'm going to stand up. You don't have to stand up. You can just follow me along in your seat. Remember, no shame, no embarrassment. We're going to be expanding our belly, so make sure you have comfortable clothes. The technique goes like this. We're going to expand our belly first. We're only working on technique. We're not worrying about the breath right now, just technique. So I want you to fill your belly up with air. Expand it out. No shame here, so I'm expanding it out. Make yourself look pregnant. Make yourself look as big as possible. I also want you to feel some pressure in your Kegel muscles or Kegel muscles. It's also called Mulaband or root lock muscles in yoga. They are the muscles that are the pee and poo muscles. I want you to feel just a slight pressure. So we're going to do that again. So breathe, expand your belly. Don't worry about breathing, just expand your belly. See how I have it extended? And I want you to feel that pressure in your Kegel muscles. And then push it in. Push it out. And put your hands on your belly and you can see it going out, out. We'll do that slowly. In, push it out. Feel those. The reason I have you feel the Kegel muscles is because I want you to know that, I want you to have evidence that you're pushing your belly out as far as you can. So when you feel that pressure of your Kegel muscles, you know your belly's as extended as it can. We're not going to do it for every single time, but I just want you to know the feel of the technique. We're going to do that again. Out, feel it. Make sure your shoulders are nice and relaxed. In, out, in, out. Keep practicing. A lot of times while I'm talking, keep practicing. A lot of times people who, I was in marching band when I was in high school, and so we were taught how to use our diaphragm. So this is the key component in diaphragmatic breathing. In, out. Now hold it, just hold it there. I want you to feel the fullness of your belly and your shoulders nice and relaxed. Feel the Kegel muscles. Okay, good. If you need more practice, just keep coming back to this portion of the video to keep practicing. Now we're gonna add the breath. The breath is gonna go like this. In your nose for 4 seconds, and then we're gonna do a double sip at the end. So we're gonna practice this slowly. We're just gonna practice breathing in with your belly coming out. Ready? Breathe in, 2, 3, 4, belly out, shoulders relaxed, and release. We're gonna practice that again. It's kind of weird. I know it's kind of weird. So what we're gonna do, I'm gonna explain it this way. When you breathe in through your nose, you're gonna act as if you're having a balloon inside of your body that you're blowing up. So there's a balloon that you're inflating through your nose. So let's try that. Just try that for now. In through the nose, belly out. Let's try it again. And one last time. In through the nose, belly out, shoulders relaxed. Now we're gonna do the double sip with the breath. We're gonna go 4 seconds breathing in. The 5th second, we're gonna double inhale. It's gonna look like this. You can do it with me. So I'm exaggerating a little bit so you can hear the breath going in. We're gonna do it again. Breathe in for 4 seconds and then double sip. I'm gonna exaggerate with you. Ready? Here we go. Breathe out through your mouth as if you have a straw in your mouth. Good. We're going to add that all together. Remember, the breath in, the belly out. I know it's counterintuitive sometimes for a lot of people because we think about breathing in through our chest a lot, right? This is breathing in to the belly. And what we're doing is we're allowing a lot of space for our lungs to have oxygen. We're expanding the space so our lungs can expand. All right, we're going to do the whole thing. Breathing in for double sip on 5, hold it for about 3 seconds, and then breathe out through your mouth, right? Here we go. Breathe in, 2, 3, 4, belly out. Double sip, shoulders relaxed, belly out. Breathe out, 2, 3, 4, 5, 6, 7. Really important that I forgot to mention. We're going to be breathing out longer than we're breathing in. Again, we're going to be breathing out longer than our breath in. So it doesn't really matter if it's 4 seconds and a double sip on 5. It doesn't matter if it's 3 seconds double sip on 4. It doesn't matter if it's 7 seconds double sip on 8. What we're doing is we're breathing out longer than we're breathing in. So we're going to do 4 seconds double sip. We're going to hold for about 3, let's do 4 seconds. Hold for 4 seconds, kind of like box breathing-ish. And then we're going to breathe out for 7 to 8 seconds. Okay? I'm going to count. I'm not going to do it with you. I'm going to count for you, okay? Ready? Begin. Breathe in, 2, 3, 4. Double sip. Hold it. 2, 3, 4. Breathe out. 2, 3, 4, 5, 6, 7, and rest. You might want to just catch your breath if you're not used to doing this. Just feel what you feel, because now we're going to do it 3 times consecutively. Remember, belly out, shoulders relaxed. Ready? Begin. Breathe in, 2, 3, 4. Double sip. Hold. 2, 3, 4. Breathe out. 2, 3, 4, 5, 6, 7. Breathe in. 2, 3, 4. Double sip. Hold. 2. Belly out. Shoulders down. Breathe out. 2, 3, 4, 5, 6, 7. If you're more comfortable with your eyes closed, by all means. Breathe in, 2, 3, 4. Double sip. Hold out. Hold it. 2, 3, 4, 5. Breathe out. 2, 3, 4, 5, 6, 7. Rest. Breathe in. 2, 3, 4. Double sip. Hold. 2, 3, 4. Breathe out. 2, 3, 4, 5, 7. And now you're going to do it on your own, and I'm going to do it with you. Ready? And there you go. Part 1 of conscious breathing, which is the physiological sigh. There's 2 more parts to it. Gets a little bit more difficult. I want you to practice this morning and night, twice a day. If you can do it more than that, that would be great. Otherwise, twice a day. 10 breaths in the morning, 10 breaths before you go to bed. Every day. We're going to build that muscle up nice and strong. And so part 2, we're going to add on to it. Part 3, we're going to add on to all of it. And then it's going to be conscious breathing. So thank you very much, and we'll see you next time.